Maragal Medical. Got my good friends in here. Dr. Tim, Dr. Mike, you guys are have been brilliant. I talk about my knee, and I was on the other day with Kemba Walker. And Kemba, I told him, I said, we did a Zoom call with him. I said, Kemba, I had the same procedure you had on your knee. I said, when am I going to start running and dunking again? He said, your knee is going to feel better. But running and dunking, he said, I don't think that's in your future. How have you guys been doing?
We're doing good. We're glad to hear that you're doing well. And as we talked to you too in the beginning, Max, it's a journey and getting to the root cause of your problem first and foremost, and then coming up with an innovative treatment plan that Dr. Marciello has put together is going to make sure that you have a very successful procedure. So we're thrilled that we've had the opportunity to be able to work with you. This is great.
I think it's just absolutely phenomenal. I think that, me walking up the steps right now is kind of new for me. It feels a lot better with my knee. I know the lady said that, she said, look, with the sweet spot is week 5 and 6. So I don't think we're quite there yet, and my knee is feeling much better.
Oh, that's awesome. That's great. And as you know, too, your experience at the clinic, we took our time to make sure that we gave you a very thorough examination. And then, as you pointed out really nicely, we gave you an education. So you really got to learn, probably some of the things that contributed to the arthritic change in your knees. I mean, certainly as a professional athlete at a very high level, that wear and tear. But it's it's the full analysis, making sure that, we're figuring out what your movement patterns look like, what your flexibility looks like. I know you had a lot of fun on our robotics with my wife, Colleen, and that's going to be really interesting as we kind of watch you over time, and as we see the changes, how your flexibility, your strength, and your balance starts to improve too. And of course, how you feel overall is going to be really important. You still wearing those orthotics?
Oh, man. I'm mad because I'm trying to get the other one in my shoes, the one in my sneakers. So I got to cut around to get them in my shoes now. I haven't quite, I was trying to push it in the other day and it wouldn't go in. So I got to get some scissors and cut it so it fits exactly into my shoe.
Well, when you come back in a couple of weeks too, just bring them with you, and I'll make sure that, I can go through and I can trim them up. And Dr. Mike, why don't you talk about too the second visit? We had as we know, we took Max in and we did a regenerative medicine injection. The choice that we used in his particular situation was an amniotic allograft injection, but as Max comes back to the clinic in a couple of weeks, we're doing a secondary injection. And why don't you kind of tell the rationale and, the work that we've been doing, with the research and what the science is showing with this combination approach?
Sure. I would start by thinking that we have to be clear here for Max. This is a two-way street. So as you mentioned, the sweet spot, potentially the 5 or 6 week mark, we always say 1 to 3 months for our patients to start feeling or seeing benefits. It's really because it's after that first month that you start seeing some improvements, but that really just opens the floodgates for you to start becoming active. So this is not a miracle injection does all the work. You as the person receiving the injection actually is what really makes the difference. So by getting you moving is really the way we see improvements. So that's why we've looked at this combination of adding a second injection of the PRP or platelet-rich plasma at about that 4 week mark, because if we can get a little bit, again, more inflammatory process out, get the reparative protein still working and enhancing the initial injection, we not only get some better improvement from the regenerative injection, but it allows that person to really start moving more comfortably and really make that difference. Because again, if we lose our opportunity to get you stronger, we just go right back to good old aging processes, and we don't really get in the foot in the door. So you're in that starting phase, and with the second injection to booster the first one is really what we like to see, where we can really improve upon your strength and your abilities.
So you're saying I am coming back to the Celtics? oh, you have to laugh at me.
You hear some different words, I think.
They need you. They need you.
That's the way to interpret it, without question.
I wanted to ask you guys, and other than because I always feel like I'm, you guys have taught me so much, but I want to ask you guys a question, which I've asked a lot of people on my podcast. And I think did I ask you guys this already about your Mount Rushmore? And somebody fluffed on me. Well, I wanted to know if you guys could give me your Mount Rushmore of sports. We're building it in your backyard. You get a chance to pick 4 players. They can be from the same sport, different sports. I'll let you go first, Tim, because you look like you got the answers. Look like Mike is like, please let Tim go first.
Okay, so I'm a huge tennis fan, so I got to go with my favorite player, Rafael Nadal. That would definitely be on top. And then I guess if we're going to put Rafa in the mix, we got to put Roger Federer there too, because that's probably one of the greatest sports rivalries going as well. I mean, growing up, I was at a time too where, as a child, rooting for you. Certainly, I think kids all my age, I remember getting my first pair of Nike Air Jordans when I was in the 7th grade. So I got to put Michael there as well. And,
okay, you got 3.
I got 3. And I think, the timing too, I think, looking at, recent events with what happened to Tiger, certainly Tiger Woods has transformed his sport and what he's been able to do. I know early on, he, as a practicing doc too, he was a big supporter with physical medicine and chiropractic care in the beginning. He's, unfortunately, he was on his 5th lower back surgery too. And I know, all of those athletes have definitely gone the regenerative medicine route. So we definitely hope that Tiger is on his way to a speedy recovery as well too. So I guess that would be my Mount Rushmore. I hope that.
It's your Mount Rushmore now. Who have you got? Your Mount Rushmore.
Well, I have to go to kind of think about the medical concept. And if I really look into what my area of interest and specialty is always coming back from recovery and getting back. So I'd also have to put Tiger Woods in that mix. This recent injury just kind of throws off everything, but to come back from 4 back surgeries and continue to try to play at a, high performance level, that's what I look for in people, is that persistence. So I would also kind of think about in relation to Tony Canigliaro. So we've been part of a movie in relation to that resilience and the ability to come back from an injury where you're not supposed to play the sport anymore. Who plays baseball with one eye? It just is not happening. So you think about relative to how does someone recover from that mentally and physically, just floors me to think that there are people out there that can just really pull it off. So the other one I would think about in relation to that concept would be kind of the Cal Ripken Jr. aspects of the persistence, the longevity, the ability to kind of play and not miss a game and stay on the field. And then I lastly throw in, which might be a little controversial, but no question the Boston world is Tom Brady, because you're talking about a great ball player, but you're playing with body parts that don't usually make it that long. And there's an element of nutrition, there's an element of, persistence of staying on your game that I would have to think those folks come to mind. And if we think longer, I'm sure we'll find more people who've come back from their injuries and problems, but those ones come to mind right away.
Man, you talked about nutrition, and I told this to Kemba Walker the other day. I said, my championship meal, 1984, Gary played the Los Angeles Lakers. across the street was McDonald's. Big Mac, supersize my fry, apple pie, and a large orange soda. I went to war with that. People right now would be like, what? You ate what? And said, well, Kemba asked me, so when did you eat it? Oh, well, maybe about 5 minutes before the game. So I'm sure you guys would frown at my nutritional choices back then.
Hey, I played college ball as well. That's all we could afford was McDonald's and Burger King. So that's what we all ate on. By the end of the week, we just can't wait for the parents to come bring some real food to us. That was tough time, but I've been there.
But Dr. Marciello will also add too that the development and the advancement of regenerative medicine falls hand in hand with the appropriate nutrition that goes along with it too. So just like your conversation, Max, with Kemba, I mean, as a Celtics player, their diet is a heck of a lot different than, your diet when you were playing back in the day. And, there's a direct correlation too with, you're seeing, high performance athletes, continuing on with their sport longer and longer and longer. And there's definitely a correlation between, diet and longevity. And then when we're talking about the regenerative medicine side, there's a whole strategy that Dr. Marciello specializes in, with our patients, with integrated nutrition to make sure that they're getting the best benefit from the treatment too.
Well, you guys talk about that, and you think about how medicine has changed, and I look at you guys' approach. But one of the things people used to talk about all the time was, and they swore by this. The doctors had this, that they had to have beer in the locker room after the game to replenish your fluids. Now, looking at it now, is that far off now, or is that just voodoo medicine?
That should be off. That should be off the table without question. We can all enjoy a good beer, but to replenish fluids is not the first choice for sure.
Yeah,
that was so funny. I see Larry Bird. The first thing you do is pop a cold one, and that was it. And it's really funny, when you guys talk about bringing everything together in nutrition and medicine and these procedures. Like I said, I just don't know how much longer I could have played. You guys, we've talked about this before. Yep. If I'd had that kind of regimen about me when it came to the medicine and the procedures and eating the right way, because that just really wasn't one of the things we did. I mean, even talking to some athletes now, they don't take a day off. Right. When I played, and after the season, the veterans will always say, you know what, don't pick up a ball. And here's one of the things they really frowned upon back in the 70s, lifting weights. That was like, oh no, don't lift weights, because that will make your muscles too big, and you won't be flexible, and you won't have speed. Now we know it's just the opposite. And I think that's the way I feel about you guys telling me about the treatments and all the things that go along with Maragal and what you're doing for regular folks.
Absolutely.
Well, if you take our comments about Tiger Woods, I mean, here's a guy who changed the history of golf, but part of that is that he was a strong man, and he still works out, and the forces and the torques going through those type of emotions day in and day out, you have to keep the body replenished. And so here's a good example of how he's kind of recovered in spite of his injuries and surgeries. So if we could all inspire everyone to, really kind of take that to heart and really make sure that they're following a nutritional program, they're following what they should be doing day in and day out, the body's going to last longer. But this is not normal to be putting that kind of forces day in and day out on the court.
And I think I would add too, the strategy when it comes to managing, pain or managing injury. I think Max can attest to this. Back in the day, it was, you see the team doc and you get, your cortisone shot to just, get you the ability to go back onto the court to play. But, the science is showing now that, repetitive use of cortisone is going to break down, the tissue. And the last thing that we want to do, especially whether you're a professional athlete, whether you're a weekend warrior, or whether, you're just somebody out there with a physical job. When you have pain, the last thing you want to do is have a regimen with a procedure that's actually going to break down the tissue and accelerate the degenerative change. The whole shift now is using this injection to help repair the damage. And that seems like such a novel idea, but it makes so much sense. And it's so great that, it's available, and the research and the science is really coming around to support the benefits of regenerative medicine. And like Mike and I always say too, the worst thing that could happen to, with one of these injections is it doesn't work. I mean, there's no side effects. There's no, you don't have those repercussions that you do with those other options. And if it helps you, as a professional athlete, to stay in the game, to expand your career for a longer period of time, that's awesome. But also, as you can attest, Max, those days as a professional athlete, and I know you knew this, you had a number, you weren't going to be a professional athlete for the rest of your life. So the whole theory with all of this is to make sure that, once you do get to that point to where you retire, you're able to function. Because Max, how many professional athletes do you know that everybody would look up to, and they were just amazing on the court, on the field, or whatever their sport with, and now it's just sad to see they can't even move.
Yeah, Earl Campbell was one of those guys that, essentially is like, this great running back for Houston, and now and played with the University of Texas, and essentially is like almost in a wheelchair when you see him. He comes to a lot of the Houston Rocket games, and they're rolling him in, and he's not as old as I am. Right. So I do say that. Now you guys talk about the procedure and the processes, and even taking the second shot. My girlfriend's waiting for the second shot now. She says she found something very stimulating. Are you guys following me here with this? Very stimulating.
I knew you were going to go there.
The regenerative process.
Where is that second shot going?
No, you come back and get the shot, baby. You got to get back in there right now. But it's really funny though. I'm feeling. I have live in the townhouse, so I have 3 levels, and I am I'm noticing walking up the steps that my knees are starting to feel a lot better, and just coming up those steps when it was a little bit almost like I was going up a hill, and now it's like it's almost like I'm going downhill. It feels so good now.
Yeah. And most important too, to make sure that as you age and go on, that you're still able to do the things that you love to do. You're in your prime now. This is what you work so hard for. This is wait a minute, let me get that. I'm in my prime now. I remember you in your prime.
Thank you.
You're in your prime time for retirement and enjoying the things that you love to do.
Okay.
So we want to
make sure. As you guys like to, I'm enjoying my golden years. You guys are right.
I didn't want to say your golden years.
No, that's good. Because a lot of people would love to say golden years right now, the way things have happened. So I think that I'm good with that. I want to talk to my friends even more, because the education you guys have both given me about the procedure and what it would do for me. What else am I going to tell them that you feel like that they would want to know about Maragal as a medical facility and your procedures that you might not have told me?
I'd take the simplistic aspect of that is that it's a whole body approach where you've had your knees injected, and we do knees commonly because it works well, but we really look at the person from top to bottom, and we really try to figure out where are the places that are not quite symptomatic, because we want to catch them early. And if we can identify those areas of early degeneration, we may be preventing that degenerative process that really goes down the road in the future. So really, we really like to harp on the idea that I'm going to look at you from the head to toe, because that's the way you keep health and wellness is by the whole body, not just one body part that's symptomatic.
Yeah, and I think that's really the key difference at Maragal Medical and how we utilize regenerative medicine. It's, for us, the regenerative medicine is a great tool, okay? But it's Dr. Marciello's approach, as he said, looking at you from head to toe, but not just head to toe, from inside and out as well. Combining all aspects with regenerative medicine. As a practicing physiatrist, he has his expertise in physical medicine and rehabilitation, but we utilize a team approach where we incorporate, physical therapy with, Max was on it, the state-of-the-art robotics technology to make sure that everything that we're doing is really specific for the patient. So, we're fortunate we're the 4th clinic in the US to have that robotics technology. And it really makes a difference because everything that we do is super specific, adding chiropractic treatment to the mix as well. And, Max, as you know, we got you on the table, we started moving things around, stretching everything out. So I think that's the big difference at Maragal Medical. It's combining the physical medicine, chiropractic, physical therapy, and utilizing regenerative medicine to make sure the patient gets the best care possible. And you throw in the integrated nutrition, that's the future of healthcare right there, looking at the patient as a whole.
Now, what was that procedure you did on me when I was on? Was it the bear claw? What do I remember?
The bear hug.
Oh, bear hug. Okay. Bear hug. Okay. I know it was bear something. I was like, what was it? Bear something.
The big mid-back. So yeah, as your posture changes, those joints in the mid-back get a little bit restricted. And if you think about it, the change of the arthritis in your knees and the way that you've been walking over time. And then certainly now, I'm a big fan of your podcast. So watching you do and record all of these podcasts, there's different areas in the upper back and the neck that get a little bit restricted too. So we want to make sure that all the joints are moving correctly. So we're taking care of you from top to bottom.
That's why I was asking you, Max, if you had lost some height or not, because we all recognize that we get older, we all shrink. But if we think about posture, it's not just structure, it's actually function and movement and getting all those joints moving so you can actually stand up tall, where a person may look like they lost some height, but really just can't stand up tall. And so those are all just little telltale signs of what the body's not doing the way it's supposed to be doing.
Well, gentlemen, I really want to thank you, and I can't wait. My girlfriend can't wait for my next shot. So I can't wait to see you guys again back at the clinic. And Maragal is just the place to be. And gentlemen, thank you very much for being on my podcast.